The data in psychiatry are very clear that that's not true. What is true is that the medications are barely, if at all, more effective than placebo.
You're selling drugs to people under false premises, under a disease that's been invented. So how do you measure efficacy among a disease that doesn't even exist?
3. Psychotropic drugs mask symptoms and come with severe short and long-term side effects.
Whatever problem you're being treated for, whether it's depression, real or otherwise, or cardiovascular disease, medicating away the symptoms is not solving the problem.
The patent medication gives the appearance of having helped because in the short term, it usually doesn't show the bad effects that are going to happen in the long term. So it's very deceptive.
The longer the patient's on the medication, the worse the prognosis is.
None of these medications hit precise targets. You begin accumulating all kinds of collateral damage. In other words, other organs in the body are actually harmed.
So for the first time, we're seeing kids in grade school or middle school who have type 2 diabetes and who have the beginning stages of cardiovascular disease.
So you see Parkinson's disease, you see tardive dyskinesias, you see other movement disorders.
Is it true that we're now seeing a lot of deaths from psychiatric drugs? Absolutely yes.
4. Psychotropic drugs can cause dependency and addiction.
One of the hallmarks of informed consent with psychiatric meds is you have to discuss the potential for addiction.
The vast majority of psychiatric drugs create psychological and physical dependency.
Most patients that I've seen that were on these drugs have difficulty getting off of them. It's rare for somebody to just be able to stop it without a problem.
5. Most mental problems are caused by an underlying physical illness.
Many physical conditions can cause mental problems or what pose as psychiatric symptoms, but the psychiatrist, in the records I've reviewed, psychiatrist does not do an in-depth study of what could be causing the problem.
And if the doctor isn't taking the time to find the cause of those symptoms, then unfortunately those symptoms may continue and there may be a serious underlying medical disorder that's being overlooked.
The question is it better to treat depression with a drug, or is it better to treat depression by trying to figure out what caused the depression and working it out with the patient?
Dehydration can make you exhibit symptoms of depression. Sleeplessness can make you exhibit symptoms of depression. Eating a terrible diet, hypoglycemia, being sedentary, all of these things are biological reasons for having symptoms of depression.
I have in my practice children who are misdiagnosed as having ADD, ADHD, who really have Lyme disease.
70% of all what are classified as mental illnesses actually have a physical cause, a physical problem causing that.
6. No matter how severe the emotional or psychological distress, there are many effective options that do not involve psychotropic drugs.
Once you've proven that there is no problem in the body and that there is no malfunction in the brain, then you have to begin to address these other levels of the self. And I think that's what psychiatry has completely stopped doing.
There are very few conditions that cannot be treated by other methods than the use of drugs.
Any forces that impinge on medicine that make us think that the drug approach is the only approach is undermining good patient care.
And because most non-drug options are rarely told to patients, true informed consent is almost never given.
When you get into informed consent, it's almost a responsibility of the patient to make an inquiry about the hazards of the drug and not rely on what the psychiatrist or physician tells them.
We can't go in and abdicate our responsibility as consumers simply because somebody has an MD after their name or someone is a psychiatrist and we think they know more than we do.
The best way to protect yourself is to educate yourself, is to ask questions not only of your doctor, but to do your own research.
Don't be ignorant, be informed. Get information from as many places as you can. That's how you'll be an intelligent, skeptical consumer, and that's how you will protect the safety of yourself, your children, and your entire family from this industry of death known as modern psychiatry.
And as modern psychiatry has permeated our world over the last 50 years, so too has psychotropic drugging. But there is a way to expose this medical abuse by reporting all complaints and adverse psychiatric drug reactions to your National Drug Regulatory Agency. MedWatch is the federal reporting program in the United States.
MedWatch is a voluntary reporting system, a passive reporting system where doctors, patients, healthcare providers, pharmacists, anybody really can make a report saying that they think that what they experienced or what their patient experienced was an adverse drug effect.
And this is what we call post-marketing surveillance. And this begins to get a look at what the side effects of long-term or chronic use of these drugs really is.
The FDA admits that probably only 1% of all the adverse drug effects are actually reported by patients or physicians.
It is only through the reporting of all adverse drug reactions that the true scale of the horrors of psychotropic drugging will come to light. You have the facts. Share this video with your doctor, and don't allow yourself, your friends, or your loved ones to become the next statistic of the big business of psychotropic drugging. To find out more about psychiatry and psychotropic drugging, or to report a case of psychiatric abuse, contact the Citizens Commission on Human Rights.